Premature infants may be exposed to glucocorticoids for a number of different reasons. Women who undergo preterm labor are often given betamethasone, which is a type of glucocorticoid, and this helps to hasten the baby's lung maturation, and once the baby is born early, this helps them to be able to breathe better on their own. So most premature infants are actually exposed this way. In our study group, 85% of the babies were exposed. And then after the baby is born, they may also receive other glucocorticoids, such as hydrocortisone or dexamethasone. And these help to maintain either a normal blood pressure or to shorten the period of time that they may need help with breathing using a breathing tube. So in our study group, 20% of the babies received that drug. So this is a very complicated issue. Research in animals have suggested that glucocorticoids can impair the development of the brain in a region known as the cerebellum, and we wanted to know if this also happened in humans. Using advanced techniques from MRI studies, we were able to determine the volume of the brain, and specifically the volume of the cerebellum in these babies. What we saw is with both hydrocortisone and dexamethasone, when given to the babies after they're born, we did see an association with decreased growth in the cerebellum. And this part of the brain was actually 10% smaller by term equivalent age, which is when they should have been born. The American Academy of Pediatrics suggests that a low dose of glucocorticoids can continue to be used in premature babies because they do not have evidence at this point that these are bad for you. But this study provides new evidence that these drugs, even at the lower doses, can be associated with impaired cerebral development when given to the babies after they're born. So the biggest problem, though, is unfortunately we don't have good alternative treatments. As you can imagine, low blood pressure, breathing problems, these are big problems for premature babies and can have long-term serious consequences even for the baby's brain development on their own. So with this new information, when weighing the risks and the benefits of giving glucocorticoids to premature babies, doctors should keep in mind now these potential negative effects on brain development, and when possible, think about using other medical treatment options first. So now we have this group of 172 babies, and we know that the cerebellums are smaller, and what the important outcome problem is are these smaller cerebellums associated with worse outcome in terms of actually their neuro exam, or is it giving them more cognitive problems or cerebral palsy? And so we will keep following these children until they're older, until school age, and then hopefully we'll have more information from that.